ribbon cutting of the new Ramona Linda Dialysis Clinic in San Ignacio signified the treatment center's opening. Government ministers and other guests celebrated the addition of the new clinic in the West. But the new access to the life-saving treatment is most meaningful to those whose lives depend on it.
I have been in dialysis, like I told you, for 3 years, and I'm living a normal life with hemodialysis. I have tried the clinic. I came last week, and it was perfect, and I'm happy it's here in San Ignacio, and many are out there waiting to come to take their dialysis here. So I just want to live a normal life, and not only live a normal, but a quality of life which I can continue with my life doing the things I have been doing.
Dialysis is a procedure that people with kidney failure rely on several times a week to clean their blood. In his address at the clinic's opening, Minister of Health and Wellness Michelle Shabat shed light on the growing number of persons who need access to quality dialysis treatment.
The patient's ability to access this level of medical service at an affordable cost is a bottleneck. There are approximately 300 persons in need of hemodialysis treatment in Belize. The hemodialysis program is a public good. However, due to the limited availability of this service in the public health system and shortage of trained human resource to carry out the procedures, the government of Belize must rely on private institutions and must follow a selection process of the patients based on the severity of their cases. Currently, 88 patients are on the government-sponsored hemodialysis program, and 31 are on a waiting list.
One dialysis session at Ramona Linda costs $200. The Ministry of Health covers the cost of 2 treatments a week for those on the hemodialysis program. The majority of patients must fundraise to cover the cost of their treatment, and they come from all over the country. Chairman of the clinic, Carlos Pereira, says making dialysis accessible for more people means they no longer need to risk their health to travel for treatment.
The purpose of putting the project in San Ignacio, Marlene, is that there's a significant amount of patients who are traveling to 2 private centers here in the city from Cayo. And a lot of those patients continue to cry of having it more accessible in San Ignacio. So with that, that is the reason why we placed the clinic in San Ignacio for accessibility for those particular patients. Over the years, and even in other clinics, as you're aware that I have interest in, we found that there was a major amount of patients traveling from the west to Belize City to the north. And I think it was very important. We have to take into consideration that the government doesn't have the resources. Therefore, it takes private sector like ourselves to make that investment.
The new clinic is equipped with 13 stations with 8 modern dialysis machines ready for use. Pereira added that the plan is to create another dialysis center in Belmopan in the near future.